Today's video is on why your FUE hair transplant is not going to grow. Steve recently had his first FUE hair transplant. He wasn't really a good candidate for an FUE hair transplant. So since you weren't a good candidate, why did you get an FUE hair transplant done? And why would someone out there who's like you not have any growth from their FUE hair transplant?
I have had multiple FUT procedures over the course of my life, and they take small strips literally everywhere over the back of your head. So it's not just like they take it from ear to ear right over the occipital bone, which is the right way to do it. This was before those days. So now that I cannot stretch my scalp, I have no chance for another hair transplant unless we did FUE. My last procedure before this one was in 2004, about 1,600 grafts FUT. And I thought I was done. And I still wasn't happy. I'm never going to be happy. All right. I have to look at this guy all the time. I want his hair. Okay.
I'm still not happy.
Sounds familiar. This FUE procedure was done about 18 months ago. So prior to that, I'd already been on the oral minoxidil in addition to the finasteride, which was starting to give my hair a little bit stronger. You're going to hear me say if you have thin, fine hair, if you have really gray or white hair, you're not a good candidate for FUE. And that's because your skin as well is kind of sensitive and it's kind of thin. And it's almost like pulling roots out of your front lawn trying to transplant them to the back. One of the problems I have with the industry, of which I'm a part of, is that some places just consider everybody a candidate for FUE. And if it works, and that's great. And if it doesn't, that's what you signed in your disclaimer disclosures the morning of your procedure or before. I have a problem with that. So using myself as a guinea pig, David and I today are going to talk about my procedure and the fact that as they were removing the grafts, and it was challenging. Like my hair, I color my hair. I'm pretty much Santa Claus gray. So not only do they have to use a small punch because I have very thin follicles, but also because they can barely see it. And you know, Dodge was the one that was pulling them out. He was really taking his time. And it was a 9-hour procedure. Now, it didn't take 9 hours to pull the grafts out, but it was a good 3.5 to 4 hours. And we got 2,000 grafts, which was a miracle in my world. But every single one of them was being inspected, as is here at Dr. McGrath's office, everyone else that has FUE, to make sure there's a sebaceous gland. So that, of course, led to a discussion between me and David about, well, David's like, what are you talking about? Like, why would a transplant be done if there's no sebaceous gland? And that's really where this video is going. What are the reasons we always talk about in regards to business models that you as a patient should consider? One of them is a boutique doctor that does this full time, that is a specialist, and does one, maybe 1.5 procedures a day. Why is that important? Well, your expert staff is all over that one patient, and they're taking their time. They're not a revenue-generating sales organization that's doing 4 or 5 cases a day. So if I'm Steve, young Steve, and I'm going to have my FUE procedure, and I'm case number 3 or case number 4 that day, and my grafts are starting to come out because I'm a poor candidate, should have never been put there in the first place, and there's no sebaceous gland, who's going to know?
So it kind of comes down to what you're saying is that in your case, you were able to get it done because every expert in the house was on you. They were all checking every single graft very, very carefully to make sure there was a sebaceous gland. So when they planted it, it was actually going to grow. And I remember Dodge has mentioned to me, who extracted your graft, that he was just like worn out that day because of how difficult it was to do your procedure. If you had been in any situation that wasn't so excellent, they would have pulled out quite a lot of grafts that didn't have any sebaceous gland with them, ended up planting those in your head. They wouldn't have grown at all.
We don't like to be negative here on this channel at all. As a matter of fact, we make it a point. We're not going to have a bad word to say about anybody. Never did, never will. And it doesn't come out well when I'm sitting here telling you that be careful any other place you go, you might get a bad hair transplant. But let's go back to the basics. A plastic surgeon, a cosmetic surgeon, a med spa that buys a machine to do FUE and is not a hair transplant doctor. They're not doing that transplant. They don't know how to do that transplant. They're hiring a team that company that sold them that machine sent in, and they're getting paid $1 a graft that day. They're quoting you 3,000 grafts. They're getting $3,000. Do you think they're really going to throw away the ones without the sebaceous gland and get paid $2,200 or $1,800? I have a serious problem with this. I'm uncomfortable actually explaining this the way I am today because It's a little bit like exposing something.
Well, it's kind of, basically what you're saying is this wasn't a day where the Bulls got to play just some random team that they were going to smoke. This was a day where it was like they had to really rise to the occasion in order to not screw up your case.
First and foremost, when you have a consultation with your doctor, with your clinic, and you're told you're not a good candidate for FUE, then why would the doctor across the street, that by the way is not a hair transplant surgeon, tell you are a good candidate? Well, I don't even, say anything bad about them. I just say that they're just don't know what they're doing. The point is, and why we're talking about this, is we're using me as an example because my donor hair is poor. It's always have been, always will be. Western European is where I come from, or my family does. Not really good hair. I'm not Middle Eastern. I'm not Spanish. I'm not African American. When you go out there shopping for a hair transplant, you're looking for a clinic, you're looking for a doctor, and one person that's a specialist tells you you're not a great candidate, please, you're not a great candidate, right? So again, going back to me, obviously I couldn't do a strip. I wanted a little bit more hair. I used the injectable treatment and we made my hair a little stronger. We gave it a shot. How do you do that if you go to a clinic that's doing 3, 4, 5 a day? Where do you find that talent 3, 4, 5 times? The point to this video is FUE is not that easy. Now, I'm going to parlay that into what I mentioned to David before we shot this video, is that I get responses from some patients across the country, around the world, that say, well, the procedure went great. And when I looked at the post-op photos, all the grafts are there. So yeah, all the grafts were actually harvested and placed. And there's a little bulb, there's a little hair, there's a little scab. And it looks like, oh my God, like that's ridiculous. That's dense packed. That looks fantastic. But only half of them grew. And realistically, not just that the patient thinks it should be thicker, okay? The reason for that is they never had a chance when they put it in. And that's what I want to bring to everyone's attention.